All right, you guys, so let's talk about Pyometra. So if you're new around here, I go by Jewel the Animal Girl here on TikTok, and I'm a vet assistant with years experience working with so many different animals, you guys, from wildlife rehab to vet assisting to veterinary pathology to animal rescue work. That is all me, you guys. So today we're going to talk about Pyometra. So Pyometra was originally thought to be simply a uterine infection. However, some officials do believe it to be a hormonal abnormality with or without the presence of a secondary bacterial infection. Usually Pyometra is associated with intact female animals. However, there is such a thing called stump pyometra that can happen in, spayed female animals when there are little bits of, reproductive tissue left behind after their spay procedure that can still develop this pyometra. Unlike humans, our dogs and cats do not shed the lining of their uterus when they don't fall pregnant. When humans fail to conceive, we shed the lining of our uterus, and this is what we call our menstrual cycle or our period, or whatever else you call it. And you may think, hey, well, don't dogs have periods? Well, not exactly in the same sense that we have periods. So the blood associated with a dog's estrous cycle is actually due and as a result of her reproductive organs filling with blood in preparation for her breeding. In humans, the blood associated with our estrous cycle is a result from, shedding the lining of our uterus because we're not pregnant. In dogs, it simply means she is preparing and her body is preparing for being receptive to mating. Following a heat cycle, progesterone levels remain elevated in preparation for pregnancy. So since most animals, like as our cats and dogs, don't shed the lining of their uterus, after several heat cycles not ending in pregnancy, that uterine lining just continues to thicken. This thickening can cause cysts to form, which can leak fluid, creating the perfect environment for bacteria to start to grow. Now, in a healthy animal, their immune systems will just take care of any pesky bacteria lurking around where it's not supposed to be. But because progesterone levels are elevated in preparation of the pregnancy, her immune system is going to be a little compromised. The reason why progesterone kind of lowers the immune system is because the immune system must be lowered in order for the body to not reject sperm and not reject fetuses. There are two types of pyometra. There is open pyometra and closed pyometra. Open pyometra means the cervix is open and allows the drainage of the infection. But eventually the cervix will close and this will turn into closed pyometra where the infection has nowhere to escape. Closed pyometra is when pyometra becomes very, very even more time sensitive. So pyometra as a whole is very time sensitive. However, when the animal develops closed pyometra, that is when it's very, very imperative that the animal gets care, because due to the fact that that infection has nowhere to leak out to, nowhere to go, the uterus just continues to expand with that infection, and eventually the uterus can rupture and that infection can just leak out into the abdominal cavity and the animal can go septic. Symptoms of pyometra include lethargy, decreased appetite, increased thirst, increased urination, or if it's a cat, I know cats will go in and out of the litter box without using the bathroom. That's a symptom, as well as extended abdomen because the uterus is filling with that infection, as well as excessive licking to the genital area. And then the biggest sign of that is going to be vaginal discharge. That is the biggest sign. You're going to notice like infectious fluid flowing out or blood, depending on the species. So that is the main, of course, depending on the animal, it's going to range, but those are the main symptoms. The most common treatment for pyometra is to simply take out the uterus and the ovaries, so a spay, you guys, and then follow up with a course of antibiotics to clear out any remaining infection that may be lingering around. There, however, are some more conservative treatments for pyometra that you can talk to, but most doctors and most vets will want to go ahead and do a spay procedure just to make sure we clear out all that infection. So, of course, preventing pyometra would be, to spay your animal. And for people who have larger breeds, there is more research and it's finally being recognized that it is beneficial to to wait to spay your animal until their growth plates fuse and things like that. However, the biggest prevention for pyometra would be to spay. There are some options of ovary sparing spay for people who want to keep their animals' hormones intact for the various benefits that is now coming out to be very beneficial for the animal's health. Ovary sparing spays is not something that's practiced a lot by a lot of vets. However, there are vets out there I've personally met that do that on a regular basis, mostly for canines. So you guys, I hope that helps someone out there working in the vet industry. You'll be surprised of how many clients come in and just don't know a few things, which is okay, you guys. That is what we're here for, to tell you a thing or two about your pets. But you guys, make sure you subscribe, follow for more animal content. Okay, peace.